Good morning, everyone. I'd like to call this meeting of the Cook County Public Health and Human Services Board to order on this Tuesday, May 20th at 8:31 a.m. First,
No. 8:31 p.m.
No,
it's a.m.
close.
Well, welcome to Tuesday morning, everyone. I was paying attention.
Sun comes up in the east and sets in the west.
The first item I'd like to hit here is to welcome our new staff, Mr. Bob Nelson.
Thank you.
Joining the team on the Children's Mental Health Case Manager, and got to read your HR blurb in the email, but if you want to take a minute to introduce yourself and talk about your experiences, and sounds like we're really lucky to have you.
Yeah, no, I'm excited to be here. My family's had a long history in Cook County, so my dad, first job, teaching job and coaching job was Cook County High School back in 1949. So
Wow.
we've been here a long time. My parents ran, back then it was called Jocko's Clearwater Lodge, so my youth, I was always up here all summer and always loved being up here, and always been a goal to live up here. And most of my work career was working with homeless youth and street kids in Minneapolis. Had a drop-in center and some transitional housing units, and then a place called St. Joseph's Home for Children, which was more of a shelter for kids. And then lastly, I've been at Scott County ran a 16-bed non-secure facility, which housed criminal justice youth and social service youth. So my career's always been with youth. I love, hopefully they don't make me look young, but they keep me young. So I'm real excited to be here.
Thank you. That's quite a resume. Welcome back, I guess we should say. But thank you for joining the team, and thanks for being here this morning.
Thank you.
Anyone have any questions for Bob?
Mr. Chair.
Oh, please.
Yeah, thank you. So, given the experience and also given the history in Cook County here, first I'd say welcome, and the question would be, what have you seen that has changed most in Cook County since you were a kid? And the other question is, what have you seen that has changed in youth in your years of service from when you began?
I think when I was a kid, the only TV we got was from Canada. We got 2 channels, so the media part has really changed now with even the internet. Like I live up on the Hungry Jack Road, so I have an internet, and that access has really been a big change. A lot of it, which I like, doesn't feel like there's been a big change. Grammary still looks like Grammary, when I was a kid, and I liked that part of it. But with kids, I think, again, it's social media, it's phones, it's the addictiveness to that, and just having a parent manage that aspect in a kid's life. And a consequence that I take the phone, and that can be a major situation. I've seen kids that gone into commit suicide because parents take their phones away because it's such a connection to them. And so I think that part has made a big change in youth. A lot of it is the same. I think sometimes how we work with kids gets different terminology, but when it goes back, some of the core basics are there. But over time, I think with anything, when you work with people, is you learn what actually works and what doesn't work. So I think things we did in the 80s, looking back, it's like, why did we even think that was a good approach, And if you work with kids, if you can base it on building relationships and base it on building trust, most of the kids that I work with, that's one thing, is why are you as an adult in my life? Why are you? And so how do you make that connectedness? So that's the part that stayed the same. Is kids want to connect, kids want that relationship, they want a voice, and it's my role as part of that is trying to be that support and making that connection. And I think it's an honor to work with, especially adolescents, to have an opportunity to make them think a little bit and make them start looking at choices. And that's how you can kind of work on that. I don't want to work with you. Well, what do you want to be? Well, I want to be this. Well, let's start here. You got to go to school to do that. So how are we going to make that happen versus, you need to go to school, you have to do this. It's building that relationship, and that's a fun part that I enjoy in this work, so.
Thank you.
Thanks, Bob. Any other questions? All right. Well, again, thank you. Have a great day, and we'll be seeing you throughout the building, no
All
doubt.
right, well, thank you, appreciate it. Now my boss has to make me work upstairs.
Yeah.
Yeah, that's my job.
Thanks,
Thank you.
guys. All right, that moves us on to our consent agenda, and that includes our meeting agenda, the minutes, financial report, abstract and bills, approval of a hire, approval of resignation. Are there any items anyone would like to pull from the consent agenda, or is there any change to the meeting agenda?
Thank you, Mr. Chair. I'd like to pull items E and F.
Okay. We'll move those down to director's report, if that's okay. Maybe we'll just do that. We'll put those right away. Seems appropriate for staff updates. Any other changes for our consent or agenda as a whole?
I move approval of consent agenda.
Thank you, Commissioner Gamble. We have a motion. Is there support?
Support.
Thank you, Commissioner Sullivan. Motion and support. Any further discussion? Hearing or seeing none. All those in favor? Aye. Opposed? Motion passes unanimously. Thank you. That moves us down to our staff report. This morning we have Plamen here, our fiscal supervisor, to give us all the nitty-gritty. Good morning.
Good morning. My name is Plamen Dimitrov, and I'm the Fiscal Supervisor for Cook County Public Health and Human Services. I'm here to present the financials for year 2024. The full year-end financial report is attached to today's agenda and available online. This presentation will explain the graphs and charts from the report and provide more context to the numbers. I will pause for questions after each slide. The revenue received was 3% more than the budget. Some of our federal and state aid is based on the amount of personnel expenses that we report, including wages, training and travel, supplies, software licenses, and program materials. Since we had increased personnel expenses and software licenses in particular, our reported personnel costs were higher, resulting in high federal reimbursement. Overall expenditures of 14% more than the budget. That was largely due to the increased personnel cost, again, software license in particular, adult mental health placement costs, and increased out-of-home placement cost. We had budgeted to use $566,645 of fund balance. We have an excess of expenditures paid over revenues received of $518,635, or less than what we budgeted to use from the fund balance. Any questions so far? This graph represents the PHHS funding by source. Federal and state grants and aid made up to 42% of our revenue in year 2024. Fees and recoveries, including reimbursement from health insurance plans and license fees, made up another 8%. Small amount of revenue came from non-governmental grants and donations, less than 3%. And the remaining 48% of the revenue came from county tax. I want to take your attention to the second graph there to the right. What this shows is what portion of the revenue for PHHS was county tax and what was other. And you'll see that in years 23 and 24, All other sources of revenue exceeded the county tax. And that is a direct result of our staff seeking competitive grants and increasing revenue from billing insurance companies for services we provide to clients and for work that our social services staff does. Any questions? Okay. PHHS expenses by department. All of the PHHS expenses fall into one of the three departments: social services, public health, including public health community grants and child care program, and economic assistance. You may remember that we had discussion last year whether we should separate the child care program from the public health, and I did that. So when you're looking at your monthly financial report for year 2025, the child care program is a separate department in our financials. But in year 2024, they were still together, so these are the percentages by department. Economic assistance, 20%, public health, 24%, social services, 56%. Any questions? And this is the Public Health and Human Services Organization chart as the end of 2024. On paper, it looks like a lot of staff. However, there is a very little overlap or redundancy in services. In addition, many of these staff wear multiple hats in their public service roles. As I go through each department in the report, you'll hear more about the work each team provides. Social services is comprised of three teams: adult and home and community-based services team has one supervisor and 5 social workers, each with a different case management and care coordination specialization, providing adult protection, waiver case management, long-term services and supports, intellectual and developmental disability services and mean choices assessments, and one social services case aide who supports this team. The team also has several independent contractors who provide in-home support services to aging population. The second team within the social services department is the children and family services team, with one supervisor and 3 social workers providing child welfare and child protection services, family assessment response, and parent support outreach services, and 1 child care licensor. The social services case aide also provides support to this team as well. The third team within the social services department is the behavioral health team. Bob and John are part of that team. They were part of this meeting earlier. 1 supervisor and 6 social workers providing substance use disorder services, children's and adult mental health, case management, mobile crisis response services. The social services case aide also provides support to this team. Contracted provider for this unit is the Wilderness Outpatient for comprehensive assessment, outpatient treatment, and inpatient substance use disorder referrals. Seems like I missed to skip one slide here. I'm going to give you a quick overview of the behavioral health team, and then I'm going to switch to the next, which is the public health team. Public health team with 1 supervisor and 4 public health educators to meet all 6 areas of Minnesota public health responsibility within the Local Public Health Act. The office support case aide provides additional support to this team. This team provided regional collaboration, grant writing, contracts management, emergency preparedness, and during the pandemic, the public health team played a major role in vaccine planning and implementation, case investigation and contact tracing, and liaison to the schools and businesses, as well as the coordination of many community volunteers with a shift to infectious disease control and prevention post-pandemic. Using contracts with Sawtooth Mountain Clinic and North Shore Health, Cook County provides several additional public health programs such as home care sliding fee program, child and teen checkup, family home visiting, and WIC, women, infants, and children. As a reminder, the SHIP program, the statewide health improvement plan, is fully administered by Cook County Public Health and Human Services, where it was contracted to South Mountain Clinic in the past. Any questions so far? Seems like I'm missing a slide here, but I'm going to go quickly over the economic assistance team. Here with one supervisor and 4 eligibility specialists who provide eligibility determination and rehabilitation reviews for many state and federal support programs such as cash and food assistance, housing support, several healthcare programs, child care assistance, and process applications for emergency assistance and county-funded burial support. 2 Case 8 provide direct support to this area as well. As a reminder, the child support services in Cook County are provided through a contract with Carleton County. The administration, since it was the administrative professional day on April the 23rd, I'd like to acknowledge our administrative staff for the important work that gets done behind the scenes every day. This includes our director, providing agency management and leadership, and local, regional, and state collaboration, 1 executive administrative assistant, 1 support case aide, with shared responsibilities between the admin team and the economic assistance team. The admin team members support our citizens' advisory councils, order supplies for our office and programs, and maintain the PHHS social media and outreach. The administrative team also includes the fiscal services with 1 supervisor, 1 fiscal officer, and accounting technician. We develop the budget, pay the bills, receive revenue, operate the Social Security Rep P program, provide complex grant management and reporting, and provide regular financial update to this board. Kudos to my team for the work they do.
Hear, hear.
Okay, we're gonna get into some numbers next here. The cost that benefit the entire agency are split between the 3 departments. So that's the administrative allocations here. This includes admin wages, postage and copy costs, office supplies and phones, training and travel for admin staff, travel and per diem for advisory board members, fees to the state of Minnesota for the merit system, and state IT support, as well as funds transferred to the county general fund for courthouse office rent, county MIS cost and labor, liability insurance, and the annual audit. As I go over the details for each department, you will notice a line item in each budget for administrative allocation, as these admin costs are split proportionally between the economic assistance, social services, and public health departments, based on a FTE. Okay? Any questions? Starting with the Economic Assistance Department, the 2024 actual expenditures were at 100% of the budget, while the revenues were within 95% of the budget. The biggest variance can be seen in the personnel cost, with the Caseworks electronic data management software licensing and implementation cost, resulting in 12% actual expenditures over budget, and the corresponding increase in federal administrative revenue. And the next item that is probably worth noting is the client programs, where we saw a lower than budget reimbursable cost, and as a result, decrease in the state and federal revenue. The expenditures exceeded the revenues by $48,358. This provides an overview of the cost versus reimbursement for three of the key programs here. There was a decrease in the client program cost in year 2024 with only 59% of the budget utilized, and thus a corresponding decrease in reimbursement. The revenue comes from the state reimbursable assistance we provide to clients. The county provides assistance for cost-effective health insurance and Medicare Part B insurance premiums to eligible recipients, and we received 100% reimbursement in return from state and federal sources. Provider transportation allows community volunteer drivers to assist eligible elderly clients with medical rights, PHHS direct bills, and receive reimbursement from managed care organizations with reimbursement rate varying depending on the loaded and unloaded mile. Healthcare Access provides assistance to eligible residents to reimburse them for using their own transportation and medical lodging. The reimbursed amount was at 138% of the cost, exceeding 100% due to timing and issuing payment and receiving revenue. As a reminder, we can continue to pay costs for the previous year until the end of February of the following year and receive revenue till the end of March of the following year. So sometimes due to this timing, we do end up receiving revenue past the period which applied to the previous year or vice versa, which affects our numbers. So that's why we have more
I'm wondering how you
revenue
can
and
do that,
expenses.
to expand
Yeah,
that idea.
Yeah. Thank you,
Plamen,
Mr. Chair.
Commissioner Gamble.
Yeah, I appreciate the report you keep, and you give us plenty of opportunity to ask questions. I'm just waiting for the presentation to end to be able to ask the question, but based upon your comment, can you tell us on tracking these, and it's an important thing to know because we often hear that from Brady, our auditor treasurer, that funding that comes in that's predicated on previous year or whatever else, if we're tracking these things consistently based upon that schedule, then we can use analytics to determine, what's what. So when you're looking at numbers, the department's looking at numbers, are you looking at them in that context so that you can separate out monies that have been earned prior to the posting that goes, in the financials, if that's clear?
If I understand your question, you're asking whether when we prepare our monthly financial reports, whether that is factored into the monthly financial report. The answer is yes. We report for each month only what applies to that year's expenses and continue to move in January, February, and March. I actually have to move all the expenses towards the previous year and all the revenues, which of course reduces the expenses and the revenues for the current year. So when you receive the monthly financial report in January, February, and March, that is strictly what applies to the current year and not what applies to the previous year.
Okay. And so you're post-dating then those earnings in previous months?
Correct.
Yeah, all right, thank you.
Frank, did you have a question?
I did, just so I understand consistently. Obviously, the third category there, the reimbursements were higher than the expenditures, and you explained why. Does that also follow through for the first two? In other words, the reimbursements that came in, and it's kind of hard to read from here, but the reimbursements that came in, thank you, for cost-effective insurances, that also would include funds left over from the previous year?
So I'll take it one line at a time. Cost-effective insurance, we receive 100% reimbursement from the state and federal in a proportion 50-50%, okay? So there is a slight difference there only because, again, of timing.
Okay.
Now, with provider transportation, we do not receive 100% reimbursement, and it depends on which managed care organization or we submit the billing for. Some pay at 100% for the loaded mile, nothing for unloaded mile, some pay different variation. So So we never expect that our provided transportation will be at 100%. We know that that's going to be somewhere between 80 and 90%. And again, another complicating factor is the timing.
Okay, thank you.
With healthcare access, again, that's 100% reimbursed, similarly to the cost-effective insurance. And again, the only reason you see a difference there is because of timing. Okay? Any questions?
Please, no? Go ahead, Commissioner Starley.
Thank you. I was curious about the food support, which rose significantly. How is food support supported by the county? What does that include?
That's on a different slide. Can we bring that question when we get to that slide?
Oh, okay, I'm
Okay.
further ahead then.
Yeah, yes, I think a couple of slides ahead.
And Commissioner Gamble.
Yeah, thank you, Mr. Chair. And so on your comments, as long as we understand that applied revenues received are in the graphs that we're showing, and we're consistent in doing that, then that information is something we can understand. And so the point is that it takes a narrative to explain, because if we were not showing it consistently like that, we'd be asking the question, why are we seeing it this way? And then when we have the narrative, it helps us understand that. So when we look at it, in the future, every time we're looking at this, we're looking at it in the context of what the narrative has informed for us. And I would just say, and maybe this has happened, I don't know, but the information that is provided here is excellent information, and I appreciate all the work that goes into that. Our lived experience provides this information to help us to make informed decisions, and if we can understand it and put it in the right context, the outward things that affect us, we can see from our lived experience how that's going to play out. And it would be good in a committee of the whole if we rolled up our sleeves and had a discussion to dig deeper to understand this, which I'm sure, from the administrative role, the budget process is something where we're taking the statistics and the analytics are applied in projecting with all the things that are affecting us, we project what we're looking at moving forward. So having this information and the detail in which it's presented is hugely beneficial. Is your role to gather the information or to use your mind to make recommendations?
Well, I don't know. I think I see my role mostly as making sure that we account for every dollar properly and making recommendations to our director. Beyond that, can I make recommendations? Sure. I don't know to what scale and what where that stops. But I take my team, I should say, we take pride in the work we do, and we make sure that the financials every month are 100% accurate. We don't submit them to the board until we have finalized every dollar that's been accounted for.
Yeah.
And I offer my assistance if it's needed, to participate as needed in meetings and provide any additional information if it's requested.
Yeah, thank
I
you.
don't know if that answers the question, but.
Yeah. And Mr. Chair, and I don't want to take too much time here, but this is, again, this is excellent information. And my wife and I just came from a commencement for a granddaughter, Notre Dame, and she happens to be in analytics. And then I have a grandson who's also in analytics, and then my granddaughter's boyfriend is in analytics. And the discussions and the presentations that were done in this ceremony, I was so impressed with the depth at which information is gathered. And then we analyze it to understand what it tells us. So information is only beneficial to the extent that it informs us. And so, again, this is excellent. And dividing it into more precise, like we've done with the child, area, that's helpful. because otherwise it takes so much narrative to explain everything, but when we can see it as, what we're providing by way of services, this helps us to be able to respond when we see the changes that we're encountering right now, relative to the financial. So that's why I think to dig deeper as to, well, what does this mean? And how do the impacts that we see that change, both in services provided and the revenue that funds those, and it used, in my experience in my previous term, if we were not keeping up on those things that were reimbursable, we're missing an opportunity for funding. And when we can demonstrate that we're doing that and that we're getting that, those are all good stewardship. And I think really understanding that helps us to make decisions to support the team and the department in what it does, because it's well informed.
So thank you for helping us turn data into information.
Yeah.
Moving on to the funding sources for economic assistance team. Federal and state funding made up to 53% of the revenue received by economic assistance department. This includes federal administrative aid, which supports some of the payroll cost of the staff providing the eligibility services for state and federal programs, as well as the reimbursement for county paid client assistance. Fees and recoveries made up 3% of the revenue. The county is required to perform collections on behalf of the state, and in return, the state allows us to keep a token portion. And the remainder of the funding came from county tax. You'll see that under economic assistance is probably one of the highest federal reimbursement rate, the highest federal reimbursement rate between all the departments. Okay, any questions? Okay, so here is the graph which shows the economic assistance new applications in year 2024. They have a total of 231 new applications for assistance in year 2024. This is higher than the prior 5-year annual average of 223 applications. Two categories saw an increase, food support and health care, while the other two saw a decrease, emergency assistance and cash assistance. The largest increase last year came from people applying for food support assistance.
Mr. Storley, you had a question about this one?
Yes, how do you do that? How do you support them? How does that consist of?
On the programmatic side, while I understand some of how it all works, probably this question should be addressed to our economic assistance supervisor. But basically is when people apply and they're approved to receive food support, they issued EBT cards which they can use to purchase food in the store, in a short explanation.
That's a SNAP program.
Yep. Food support and SNAP are used interchangeably. That's.
So is this an indication that there really is a growing need out there now through 24, and we're into almost half of 25?
Well, there are no numbers to year 2025 here, but if you look at the average between 2019 and 2023 of 121 new applications a year, 2024 had 136, the biggest increase. So
yeah. I mean, up to through this data. Allison, was there anything more you wanted to add?
I think it's worth noting here as well that these are new applications, not active cases. So this may demonstrate an increased need, but it may not demonstrate an increased level of benefits going out to members of our community member. That doesn't mean that that's not reflective of the workload of our staff. They're still having to process those applications, interview the household, gather the data, determine if they're eligible for those benefits or not, and if at what level. But this may show, and again, we'd have to talk to Dagmara. She gives a presentation every fall in November to get a more detailed analysis of what she and the team are seeing here. But what this could reflect is more people needing financial support for food. We're seeing that nationally and across the state with increased demands on food shelves. But these households may or may not be eligible for or receiving those benefits. So we're getting the applications. That's still workload that may not be reflected in the benefits received by members of our community.
Commissioner White?
Allison, so if someone qualifies for food stamps, is that based on the size of the household? Is it a set number? Is it a sliding scale type situation?
It's based on a, excuse me, on a range of factors. Their household size, how many people are a part of that household unit that are purchasing and preparing food together, the citizenship status of the household members, their utility expenses and housing expenses, their earned income or unearned income. All of those are factored into the budget in terms of the benefits that they are issued. Yes.
So you said there's citizenship?
Mm-hmm.
So if we have someone who is not a U.S. citizen, but is working here in Cook County, or I don't know, they would come in, they would not be eligible for food stamps.
I don't know that I have the depth of knowledge on policy anymore retained to speak to the citizenship
Well,
status.
I just couldn't, I mean, I guess I was like, you come in for food stamps if you're just, I don't know. It's another area that I hadn't ever thought about. so.
It's a factor. We don't have the depth to know how the factor plays in, but it is, federal dollars, so we're just
Yeah,
following
okay.
whatever,
Yeah, okay.
whatever system they have in place and, comply with that.
So when, excuse me.
No, please.
So when a family or a person comes in for food stamps, they fill out a form, and is it just their income or is it their assets also? Like if they own a lot of property, like somebody, they bought land cheap 30 years ago and it's worth a lot of money now, but they still work for $15 an hour and that's what they have. So is it assets and income?
You're really testing me on my policy knowledge here, Commissioner. I don't believe there's an asset test for the SNAP program. So a
Okay.
person can own their home, they can own vehicles.
Okay.
It's really looking at their income, whether it's earned or unearned. It could be Social Security income, unemployment insurance income,
Sure.
their housing expenses,
Okay.
and the state-defined limits for each of those.
I just got curious right now, so.
It's a good thing.
And you don't have to come in to apply. You can apply online as well.
Commissioner Gamble?
Yeah, thank you, Mr. Chair. So the statistic we're looking at is a statistic that says the increase or decrease in number of applicants.
Correct.
But it doesn't, unless I mess something in future slides here, of those applicants that apply, we're finding an increasing number are qualifying. So in other words, what's the result of the applications as to acceptance? And that would be a question. To the issue of whatever matrix are used to determine whether or not a person qualifies in Section 8 housing, which is a HUD subsidized, that an individual comes in and they're assessed based upon the matrix that HUD sets up, which is, what's your income? And your income is your annual income that comes. If you have a significant number of investments, but you're not taking out retirement or dividends from those investments, they're not calculated into your annual income because you're not receiving that income to expense. But you do have assets, which can be a house, investments, and everything else, and they are at a less amount as far as their consideration in whether you can apply or not. So we'll see applicants that'll come in that HUD will set that threshold, and in Cook County, because HUD makes a determination as to where they think rent should be, it's really not reflective of where rent should be in Cook County, given our realities. But you might come in with the HUD threshold on what you make, but then because HUD sets the rent rate, that makes a lot of people not qualify because that rent rate is set down. So whatever the program is, we have a number of people that apply, when they come in, and but it's based upon a set of criteria. It's whether that criteria is well informed or not. But to the question of number of applicants and actually number of people that receive benefit.
And if I may, Commissioner, the motivation for including the applications, as I understand, is to demonstrate the workload, right? This is a presentation on our year-end financials. Our personnel expenses are the highest proportion of our expenses as a department. So showing the volume of applications is reflective of the work that our staff is doing, not necessarily the level of need in our community. That data will come through in our November report from Dagmara. If anyone's interested in a mid-year snapshot of where we're at in terms of eligible population, I'd be happy to work with her to pull that data together.
Appreciate that, thank you.
Okay, thank you, Plamen.
Again, as a reminder, the child support services have been contracted to Carleton County since 2013. That includes case intake and assessment, establishing paternity, locating absent parents, establishing and enforcing orders for child support or spousal support, collecting on current orders. In year 2024, there were 96 open cases in Cook County.
Please.
Question, when you look at that in the context of Cook County, you look at it in the context of the state, and you look at it in the context of the country, and then in the context of the world, because of a decreasing population, that we don't have as many kids as we have, it's like, has the need lessened, or it's just that the number of children in our population demographic have decreased, which is affecting those numbers?
I don't have enough information to provide an answer to that question, but we could certainly get that information and report
Because
to the board.
in a lot of cases, when we're looking at statistics, that we have to look at in the context beyond, you know, what do those numbers tell us? And it might be a reflection more of the demographic change than it is that the need no longer exists. Need could actually be going up with the number of people that need the service going down.
Please.
Commissioner, just looking at the numbers, over 4 years, a drop of a third in the numbers, that wouldn't be reflective of children aging out of the children category. You know, you wouldn't lose a third of your children over 4 years, even if there were zero replacement at the bottom. And there are, obviously, children being born in Cook County and moving into Cook County. So that might be part of it and would be good to know.
Rena,
A quick
please.
comment, sitting on the school board, we look at the number of kids all the time in the community, and it's been pretty stable for a while, maybe even a little bit on the rise. So it's kind of almost counterintuitive here, but
Yeah.
there's not a drop-off of children in that period of time.
Yeah.
There is over a period of maybe a couple of decades.
So these
The numbers have gone down quite a bit in the schools over the last 30 years. But in the recent past, they're pretty stable.
Which then comes to the question of, okay, so it's great that there's been a one-third decline over 4 years, but my skepticism says, why?
Yeah,
Is that
no,
because
it's-
we're not finding them, they're not coming up, or is it because there's an actual drop in need?
Well, I mean, our staff does a lot of preventative work too. And that has a direct effect on
Okay.
what's happening in the community.
Okay,
We have children and family services working, we have the behavioral health team, we have the social services team.
so a child may not get to the point where you have to open a case and, okay, great.
And is it Dan from Carleton County? Yeah, he was just here presenting, and I just can't remember, but it was a similar trend in the region, maybe not quite as extreme, I can't recall, but I just don't remember what his explanation was. He didn't have, this is why, but it was ideas, please. Yeah.
If I recall, it was a combination of factors. Child support cases opening is often driven by a non-custodial parent applying for benefits through the state. So if a non-custodial parent applies for medical assistance, that opens up a charging case for child support where the state is going to collect income from that non-custodial parent. Sorry, if the custodial parent applies, I got mixed that up. Custodial parent applies
Yep.
for benefits for their child, and the non-custodial parent has income. They go to court, I'm
Gotcha.
grossly oversimplifying this, to charge the non-custodial parent to reduce the amount that the state is paying for that child's care, whether it's medical assistance, cash assistance. So this could be economic factors in a community that are driving this decrease. It could be the drop in numbers of families eligible for medical assistance following the COVID-19 related waivers that were in place for many, many years that kept people eligible for health insurance without having to go through a regular renewal or reapplication process. But yes, I believe that Dan reported that what we're seeing in terms of this steady decrease is consistent with statewide trends.
Food for thought. Thank you, Plamen.
Social Services Department, the second of the three major departments in Public Health and Human Services. For all three units of social services, costs were 10% over budget, and the revenue received was 6% less than the anticipated. $200,000 of fund balance was budgeted. $426,984 of fund balance was used. The reasons here I'm gonna point out, several vacancies remain unfilled at year end and into 2024. This led to a reduction in personnel cost and associated federal and state aid. The biggest variance we're seeing in children and family services, including out-of-home placement expenditures, exceeding the budget with 221% of the budget amount due to the number of children in out-of-home placement remaining at a high level. 15 children were in out-of-home placement in 2024, whereas only 8 in 2022 and 14 in 2023. Mental health services expenditures exceeded the budget with 199% of the budget amount. This was largely due to the mental health placement in state-operated mental health facilities for a client care, with over $251,067 expended. But in year 2024, there were children's mental health placements as well, for a total of $28,849. On the revenue side, some of the state and federal allocations are based on expense data or client counts from previous years. We received more revenue for foster care aid than budgeted in 2024 in correspondence with the increased expenditures. We increased substance use disorder services revenue, with still room for improvement, but the new electronic health record will assist us in achieving this goal by providing better record keeping of services and streamlined billing workflow. And a lower reimbursement revenue in other programming areas corresponds to the lower expenditures. Any questions?
Yeah. Usually, when we see a large increase in expenditures, there's often an offsetting increase in revenue, such as line 2. Okay, we had 221% increase in the expenditures, but you also had almost a doubling of revenue. It looks like just the opposite is happening with mental health services, where you have a doubling in expenditures, but yet only received a third of the reimbursement. What happened there?
So the mental health services, the biggest item here that I was contributing to this was the placements in mental health facilities, the regional treatment centers.
Yeah.
We receive $0 reimbursement from state and federal funds for these placements.
So it's the type of services that were provided.
Yep. There is a lot of noise in most, or if not all, counties in Minnesota, because these expenses drive expenditures high for many of the other counties, and one placement, even for one person, can in a small county like us can lead to 300 and, I'm not saying that the mental health services is that because we had one person in placement, but only one person can drive the cost because those expenditures are so high. In some cases, up to $2,000 a day. Like that's significant cost per day. So, yes, unfortunately, we get zero reimbursement for those.
Commissioner Gamble.
Thank you. In some cases, when you're looking at funding potential for various services provided, if there's no federal or state dollars allocated under that particular service, in the hospital's case, because of the care center and looking at services that they provide in the hospital generally, they're trying to look under the basis under which funding is available. They're trying to see if some services provided could be charged under a different category in order to enlist some of those refundable dollars, so to speak. Usually when that happens, if somebody finds a means of being able to generate revenues in an area where they're not allocated, but we put it under a different category, which is allowable, then it can be that the agency will change to exclude that so that you can't get it back door, so to speak. Anyway, my point is that the hospital, trying to be creative, is looking at ways maybe where we don't have the funding, that maybe we could put it in a different category in order to get the funding, doing it ethically, but doing it under the provision that's in place. And so I'm just wondering if there's anything that we're allowed to do when we're analyzing and understanding, could we do something in order to be able to generate revenues where those funding sources traditionally haven't been available?
So in the cases of these adult mental health placements at state-operated facilities, these are often court-ordered placements for individuals with some of the most complex mental health, chemical health, public safety needs, and there isn't a lot of flexibility for us on a department level to really influence that from a revenue standpoint.
Okay. Yeah. And as long as it's a provision and it's an ethical response to a need, I think that resourcefulness is something that we need to be mindful of, so appreciate that. Thank you.
Any other questions? Funding sources for Social Services Department. Federal and state aid made up to 32% of the funding for social services revenue. Fees and recovery funded another 13%. This is from billing health insurance companies for client waivered services, care coordination, and targeted case management. A small portion came from non-governmental grants. One example is the Arrowhead Behavioral Health Initiative, and the remainder from county tax. Social services, some statistics here about hours. The number of staff hours in children and family services continue the downward trend due to vacancies in this unit. We've had a lot of turnover in the children and family services, and that's reflected in the hours on this graph here. The number of children in out-of-home placements saw an increase in 2023 and another increase in 2024. This includes children in foster homes, group homes, mental health, residential treatment, or correctional facilities. The number of children in out-of-home placement is at the highest level in the last 5 years, 15.
It's not a direct inverse relationship, but looking at our staff hours versus the out-of-home placements, it's makes sense.
Social services and employment and training. PHHS contracts with Arrowhead Employment Opportunity Agency, or AEOA, to to provide employment and training services for recipients and MFIP or DWP benefits. The MFIP is the Minnesota Family Investment Program, and DWP is the Diversionary Work Program. In the last couple of years, the number of clients who were required to participate in these services was reduced due to state waivers remaining in place since the pandemic. When I was preparing this presentation, I asked the Economic Assistant Supervisor Debra whether, I couldn't quite remember when the waivers ended, but the waivers were partially in place in year 2024 as well. Even though I don't, and the asterisk right next to 2024, it was a period of time where the waivers were still in place. Any questions?
Yeah, can I clarify, again, MFIP, Minnesota Family, what?
Investment program.
Investment program, okay. So, I'm familiar with, anecdotally, I'm familiar with a case where we don't have someone who handles that in Cook County, is that correct? It's administered out of some other place?
Correct. AOA does, yep.
AOA does that, okay. And that was, funds were not available relatively early in the year? Am I wrong there?
I'm not familiar
That
with
program is still funded? MFIP is still funded and they're taking applications?
Yes, this is a state and federally funded program administered by our staff. The issuance of cash benefits is administered by our staff. The provision of employment and training services, which is a requirement for families to be in compliance with program rules to continue to receive that benefit, that's provided by AEOA through a purchase of service contract agreement. And I think we have a local employment services counselor unless that changed.
Okay.
This might be housing case management is provided regionally, or perhaps energy assistance is also provided by AEOA. That has
Oh,
limited
okay.
availability based on the time of year.
So the MFIP is, provides funds, certainly training and support in job and career development. And then that's the DWP aspect of it, and the MFIP, it provides direct financial aid to allow, again, it's an investment program, the idea being that it's not a cash grant to buy food, it's investing money so that the wage earner or wage earners can get a job, improve, get training to get a better paying job, that kind of thing?
Yep, correct. So the DWP program is a shorter, more intensive program.
Okay,
Oftentimes, a family applies for the diversionary work program, and then if they aren't exiting benefits at the point that they complete that program, they would go on to MFIP, the Minnesota Family Investment Program, or sometimes a family qualifies for family stabilization services or has barriers to employment. Maybe it's a disability or other factor in the household. Both programs are time limited. You can only receive, I think it's 5 years of benefits or 60 months. And the cash grant in the case of DWP is vendor paid towards rent or utilities. MFIP, again, there's a little more flexibility in terms of how that cash grant is issued depending on the household circumstances. And it includes a food benefit and a cash benefit.
thank you.
Yeah.
Shifting to social services, substance use disorder services, the number of clients served. Public Health and Human Services contracts with the Wilderness Outpatient Treatment Program to provide comprehensive assessments and outpatient group or individual treatment services, while our staff provide the coordination with facilities for inpatient treatment and financing. In 2024, 52 comprehensive assessments were conducted, and an inpatient treatment coordination was provided to 32 clients. 12 clients participated in outpatient treatment services. Funding sources for the contracted services for substance use disorder. The program is funded mostly by county tax. 14% came from liquor license fees, which is 1/2 of the liquor license fees collected by the county. And 7% from private paying clients or insurance fees.
Can I make a comment on this slide? We invested in a new electronic medical record, as you might remember, in late 2024. As a result of that, we're expecting this proportion of county tax to be much, much lower next year as we have a more functional health record system for billing and documenting.
Mr. Chair. Just for clarification, if the percentage is staff time, which is charged to the county tax, and we've got a software system that makes us more efficient, it's basically the time in wage that's reflected then in this. In other words, the cost for staff, because we're seeing how much staff time is invested in this. If we can find methodology that reduces staff time, it's going to reduce that number because the impact of staff time on being funded through county tax, that's what you're saying?
That's accurate in theory, but in the representation of this graph, this, as I understand, Plamen, correct me if I'm wrong here, this is fully purchased services through our licensed drug and alcohol assessor. The purchase of service contract that we have with Greg Barnier Wilderness Outpatient Treatment Program, that's the funding to pay for Greg's contract. Yes, there are staff time associated with the operation of the outpatient treatment program. Melissa has a significant role in that, in meeting with residents, determining their funding source. Plamen and his team with billing for services. So there are indirect public health and human services staffing costs that I don't believe are reflected in this graph. This is
Okay.
fully the revenue for the assessment and treatment component of the program.
All right, thank you.
Correct. The detail of this can be found on page 13 of the financial report.
Okay.
And the majority of the expenses come from the contract services with wilderness outpatient. A portion we pay to the behavioral health fund for our county share for having the county participating in the behavioral health fund for the state of Minnesota. And the administrative cost, that is where part of the personnel expense. If you remember at the beginning of the presentation, I talked about the administration cost and what it included, some personnel expenses, travel, and so forth. And so that is the third largest expense in the ASUD program. So there is some personnel expense, but it mainly is the contracted services.
Thank you.
Okay? Mental health services, staff hours were up in 2024. And the next slide is going to show the mental health clients in work group. While the number has fluctuated in the last 4 years, 2024 saw a significant increase in both adult mental health and children's mental health work groups to the highest count in the last 5 years. The number of adult clients receiving intellectual and developmental disability services had progressively increased in years 2020 through 2022, decreased in 2023, and increased again in 2024 to again the highest levels in the last 5 years, while the number of children receiving these services has been consistent. This includes clients receiving CADIS services or community access for disability inclusion, home and community-based services to children and adults which require the level of care provided in a nursing facility. This helps a person living as independently as possible in a community rather than in a facility. Social services, adult services staff hours. Again, this team has been experiencing turnover since 2022, resulting in less reported staff hours in 2022, slight increase in 2023, and another decrease in 2024. Social services, home and community-based services, number of individuals receiving services. The adult services supports our aging community members who need additional help to remain in the community. The in-home support program coordinates local independent contractors to provide homemaking, chore and transportation services so that people can remain in their own homes as long as they would can. Some of the costs for providing these services are reimbursable through the recipient's waivers. We have seen a steady growth in the number of people seeking these services. However, due to lack of service providers in the county, there is a waiting list for the people that receive service. I know that our in-home support coordinator is working hard to recruit and onboard new providers, and we anticipate that number of people receiving services will increase or has already increased in the year 2025. So we'll almost halfway through the year here, I feel confident that next year we'll be looking at a higher number than what we have in the year 2024.
And these services include things like housekeeping, cooking,
Yep.
not medical care.
Yeah, these are primarily homemaking, chore, and transportation services.
Thank you.
Public health. Public health, again, including the child care program, costs were 46% more than budgeted, and the revenue received was 41% more than budget. While the department was budgeted to use $366,645 of fund balance, all under the child care program, only $43,293 were needed. One FTE was added in year 2024. The contracted services cost came in 3% over the budget with 7% more in revenue. The child care program expenses were right on budget, with the wage subsidy program actually significantly under budget with $142,394 less than budget, while we received over $184,000 in grant revenue related to the child care program that was not budgeted. And that came from DEED, Department of Employment and Education, with $153,110, Minnesota Department of Education with $6,000, and the Northland Foundation with $25,000. Any questions? The funding sources for public health, 52% of the funding for public health came from federal and state grants, mostly from state, the larger of the two. 2% from non-governmental grants and donations, and the remaining from county tax. Earlier in the presentation, when I was going through the staff chart for public health, I said that they work within the 6 areas of public health, and this is how the hours were reported by staff for year 2024. 33% assuring an adequate local public health infrastructure, 4% protecting against environmental health hazards, 1% assuring health services, 12% preparing and responding to emergencies, 1% preventing the spread of communicable diseases, 49% promoting healthy communities and healthy behaviors. The public health community grants are awarded to community agencies through a competitive annual grant-making process. $150,000 were awarded in year 2024. As a reminder, a subcommittee of the Public Health Advisory Committee makes funding recommendations each year, which is presented to the Human Services Board. Grants are made in line with the goals set forth in the Community Health Improvement Plan These represent areas of essential community services that would go unfilled without support through this grant-making fund. This is the list of the 2024 recipients of the public funds.
I'd just like to call attention to the largest recipient, the Cook County Council on Aging. I sit on that subcommittee, on that grant subcommittee, and this is something that I would like to bring up. We may not have time today due to time constraints, but I would just like you to keep that picture in your mind for future discussions.
Yeah, we're going to be meeting with the hub, or the Cook County Council on Aging Board at a future committee of the whole, or, and just to discuss the state of affairs there and the funding situations, so.
And they provide essential services. I mean,
Absolutely.
But just be aware of the scale.
Right, oh yeah, yeah, and it's less than they were asking for, too.
Oh, yeah.
Yeah. Commissioner Gamble?
The community as a whole is the best venue for that discussion, and so we can be more in depth in that discussion too, so
Yeah,
it'd be good,
yeah.
yeah.
That's that. Oh, almost.
No, we got a little bit to go yet.
That's the end of mine. Oh,
Yeah.
Overall, 3 departments that made up the Public Health and Human Services saw an increase in actual expenditures and a slight increase in revenue. This resulted in $518,635 use of fund balance, while $566,645 were budgeted, or we used $48,010 less than what we budgeted. The actual unrestricted fund balance as of December 31st of 2024 amounts to $3,305,844. I want to take attention to that number. That's an important number. That is what we have in the checking account to operate for the years going forward. And why that number is important is because we have some requirements to maintain a healthy amount of fund balance, because our first tax distribution is done in May, and we need to have healthy fund balance to allow us to operate in the first several months of the year while we are waiting to receive our tax distribution. So, what that percentage comes is we should be able to operate for the first 5 months, or that is 42% of the year. So 42% is the requirement minimum amount of fund balance we need to have that is percentage from our budget for the following year. That is why the $3.3 million amount is very important.
Commissioner Gamble has a question.
Yeah, thank you. Yeah, just, who sets that requirement? In other words, it's not an internal assessment that we just say we think. In other words, the industry itself or a government agency is just saying, this is it. I mean, when we look at the county fund balance overall, it's just who's giving the directive as to where it should be.
The Office of the State Auditor.
Okay.
Yep. For our Public Health and Human Services, that requirement is 42%. My understanding for the Highway Department, that's 60, and for the general fund is 75.
Okay. Thank you.
Right? Good question. All questions are good questions, so please go ahead and ask if you have a question. Okay, so this graph I'm going to take a moment to explain here. The blue bars represent the annual budgets going back to 2021. The red bar represents 42% of that budget, which is how much PHHS must hold in reserves to meet the first 5 months of expenses. The green bars indicate the actual amount of public health and human services reserves for each of those budget years. It wasn't that long ago when our fund balance fell below the state required minimum. It's not shown on this graph, but there was a time where it was below 42%. However, in years 2021 and 2022, due to decrease in planned expenditures and increase in third-party billing efforts, we had recorded an excess of revenue over cost, resulting in the return to the fund balance. We began using some of that fund balance with budgeted of $656,881 in year 2023 and $566,645 in year 2024. And why we did that is because if you look at the green graph in 2023, well, our fund balance was more than our budget. And so we reduced the levy by using up some of our funds, some of our reserves, which reduced the levy request. We did the same in 2024, and 2025 we are reducing the levy amount by using fund balance. And again, in 2025, the budget includes another use of $566,645 in the current year of funds in event of unbudgeted out-of-home placements and to fund the child care program subsidy. While PHHS still has a healthy fund balance and against to the bearers requiring minimum in reserves, we're working currently on the budget for 2026. And my recommendation for that year will be to use very little or no use of fund balance. There's some sense of uncertainty in the federal government and in the state level too. But I think I'm going to save that presentation for when we present our budget sometime in August. I think we're going to do that.
July 15th at the Public Health and Human Services Board meeting, I believe is what the budget calendar states.
The challenge we have with presenting, and we can't do that early in the year, is first we're only halfway through the year, the current year. So our financials, while we use prediction based on several years prior, it's a little bit uncertain. Two is we don't get our allocations for the next year until sometime in July and August from the state. So again, we take 3-year averages, we take so there is a challenge of presenting to the board that early in the year. And I think without going too much into the budget for next year, one other significant expense, it's related to personnel, is open enrollment is not completed until sometime in November. And I don't know how many people will select health insurance and how many are not gonna. And that also has an impact on our budget. So in any event, we'll be presenting a preliminary budget in July, but with some challenges.
Just a teaser there.
I'm just saying what's the reality is.
Commissioner Gamble.
Yeah, thank you. In the case of fund balance for the county as a whole, my question is, other than just stewardship of dollars and having something to fall back on if we meet challenges, unforeseen challenges, in the case of the fund balance for the county, the benefit, in addition to having monies for rainy days, is that it affords us a better bond rate. So I'm wondering what other benefits exist other than having the rainy day funds, like in some cases requirements when they do analysis on generating money or grant funds or whatever, when they look at your financials, if we see tangible benefit because of where our fund balance is. In other words, does fund balance afford us anything beyond having money for rainy day?
Well, that question might be probably for Brady as much as anyone else, because our fund balance, the way I see our fund balance is a reserve that allows us to operate. But we don't invest our fund balance and put it in, at least public health and human system, we don't. Now, on a county level, there might be some mechanism for earning some revenue based on what's in the bank. But in public health and human services, whatever we see is whatever it is. We don't get percentage of interest because we've invested the money somewhere.
Right, but in my point, in any area where we see benefit, and it can be that in grant applications, when they're looking at your fund balance, just like in the county, when we're looking at bonding, when we get a rating based upon where we are financially, which includes fund balance, then that has benefit to us. So if you're making an application then for grants and stuff, and people looking at it say, boy, this is good, then that's affording you additional dollars because of your financial position, I see.
Yeah, I do understand your question better now.
Yeah.
There are some programs that are directly funded by fund balance.
Yeah,
The wage subsidy program and the public health grant funds.
yeah,
So a healthy fund balance means more opportunity to spend more money within those programs.
Yeah.
Whereas lesser fund balance amount will probably put a little bit of pressure or some pressure on the wage subsidy program and on the public health grant funds.
thank you.
Allison?
Yeah, just to expand on Plamen's response, to my knowledge, we aren't reporting fund balance as a part of competitive grant applications to the state. I don't think that makes us more competitive. However, the board's decision to invest fund balance in programs like the child care wage subsidy program is making us significantly more competitive in those big deed grant applications because there's a county match.
Is it a requirement, the county match, because many times it is a county match, requirement in order to receive the funds, in which case, because we have fund balance, we can do that, so.
So indirectly, yes.
Pardon?
Sorry, so indirectly, yes.
Yeah,
For the wage enhancement, the county match isn't a requirement.
okay. In
My
some
understanding is
cases,
that it's making us more competitive because we're able to complement those county dollars with state funds to increase our impact to the benefit of providers and families.
Thank you.
Frank?
Yeah, and Allison, just to take that a little bit further and put it in context, I think over the last 2 years, on the child care wage enhancement program, I've probably gotten about $400,000 for the wage enhancement program directly out of the fund balance. And I'd just like to point out, looking at the numbers, that's not sustainable.
Right.
So if that wage enhancement program is going to continue, it can't be continued to be funded from the fund balance.
And we will be presenting to the Committee of the Whole in July with a mid-year update on the wage enhancement pilot and plans for 2026 budget and seeking direction from this board on how to move forward.
One more slide on fund balance is, this is what it would look like if public health and human services was required to hold 75% in the reserves, just like the county general fund. The use of fund balance in 2024 has resulted in the public health and human services available reserves to be at 65% of the budget, but not at 75. We intentionally have been using fund balance because we've had a good healthy reserve, but we're getting close, if not at the point where we cannot sustain to use a lot or many, or maybe even none of fund balance, because we're not gonna meet that 42% of requirement if we continue to do so, and because frankly, there is a lot of uncertainty on the federal and state level, so
Yep.
we should carefully examine that when we prepare our 2026 year 2026 budget. And I know Allison and I are carefully looking at the numbers and trying to make recommendations to the board. Any questions? Again, here's our final budget and financials for 2024. And Any final questions for me?
Thank you, Mr. Chair. I appreciate the discussion and look forward to the committee of the whole. I think it's really good to be able to dig deeper, and I appreciate the time. In the information presented, it would be interesting to see on a graph by department the percentage of revenue that is coming from tax dollars. So if we take a period of time, you took, from, what was it, 2021 or whatever, but if you take, let's say, a 5, 6, 10-year, whatever period, and then you go and you look at the percentage that is coming because we're resourceful and we're getting grant funding, you can look at the percentage that's coming from state, the percentage that's coming from federal, and the percentage that's coming from our levy. And if you put that on the graph by department, we can see trends. And if you see a trend where the percentage that's coming from tax levy is going up, and we see that it's going down in our grant funding or other areas, it just helps us to understand, to the extent that we're resourceful and we can get more monies from grant and it pushes down that tax levy impact, that's a good thing, and that's the kind of stuff we should be publishing to say this is what we're encouraging. So, but I would like to see by department the allocation of where our revenue comes from.
Can I just clarify your question, Commissioner? Are you looking for by department within the Public Health and Human Services Department, or
That's correct.
PHHS within overall county? Okay.
No, yeah, relative to public health, because you divided it into your categories, social services, mental, and child. Take it by department and take our source of revenue and show us the trend where things are going. And then when we go into this 2026 budget period, whatever the fallout and whatever we see there, now we're going to see the impact of those areas that are threatened, and where are we going to shift that? And as our directive is we have to look at the level of services, and we have to look at where the money's going to come from. But it'd be helpful to see that trend.
So basically, that graph only broken down per 3 departments.
Yeah.
Okay.
Yeah, if that's possible, I'd like to see that.
Yeah.
And the other thing that's a component of that is if you take similar counties within Public Health Human Services, how did they reflect percentage of levy contributed to those departments?
So break this down and then ask other counties to break it down.
Well, I don't know if I have a pull on that account, but I can certainly prepare the information
We'll give you
for
some,
Cook
we'll
County.
give you some pull there. But it'd be helpful to see. I mean, those things you can celebrate or you learn from, I think it'd be beneficial. Because we're all in this together kind of thing. It's just how are we together learning our stewardship.
The more practical might be just the state. Like, I don't know how many counties we're gonna, as we're preparing our budget, I don't know how many other counties' budgets we can dive into to compare.
Well, I mean, you ask the information and you, I mean, respectfully, it's not a demand, but you ask the information to the extent that you can get it. I mean, for me, looking at the wage thing and talking to 87 counties about the wage thing, I got a lot of information. When I put that together, I can graph it out. And so I think the task can be overwhelming on top of what we're doing, but we're in a situation where I think the more we can form and the more we have contacts, the more we either are firm in it. I know in doing budget, as an executive director, I would show comparables with regions, with nature, and of other organizations, total budget, and it allowed in our annual meetings, people to be board members and people that were interested to be able to compare. And they could ask questions, say, how come we're so much lower? How come we're so much higher? Because that context was provided. So I'm not trying to belabor, but I think it's helpful information to the extent we can get it.
Rana had a comment, and then Commissioner
I
Sullivan.
just want to say that, when you're working with people, and especially children, if we're investing services for a young child who then goes on to lead a healthy, normal life and doesn't need to be, for example, in treatment for a year, that would be expensive, that's a benefit. There's no way of really quantifying that, but I think the whole program works for people where public health is helping them to be successful in life, which is not only saves money, but benefits the community. So that's the way I see it. You know, the numbers aren't comparable in certain ways because of that. We know we have a lot of elderly people here where they need certain things, but also, you know, the goal is to improve people's lives. That's what public health is doing, you know, physically and mentally, whatever.
The service and the costs, respectfully, the service and the costs are two things. Obviously, our whole endeavor is to try to let our services improve people's lives.
Right.
And so that's there, but there is a measurable cost that is there. So I think it needs to be looked at that. Coming out of the corrections board meeting this last week and the number of testimonials, people 20 years later that bump into people that were their counselors and seeing where their life is at.
Yeah.
Those are tangible things,
Right.
but there is a cost associated with it. And for us, when we look at the county as a whole, it's where do we invest dollars in roads, in people, you know, in buildings, and it's just part of stewardship, but I agree.
Yeah, yeah.
And it ends up being a blessing when you see the bread coming back on the water. Yeah.
Commissioner Sullivan?
I was just going to say to Commissioner Gamble's request to look at levy kind of through different counties, that at our district meeting in June with AMC, that might be a great place to ask for that.
Or even ahead, so
Yeah,
they
yeah,
can speak to it.
So people could provide it
Give them
at the
time,
meeting.
yeah.
Right.
That's a good idea.
I can certainly prepare information for, I intentionally excluded 2020 because that was a little different year. So I'll prepare information for the last 4 years for the revenues by department.
Yeah. And I appreciate the narrative that informs relative to why did you pick the years that you picked the years? Because sometimes we pick the years, you know, to represent what we want to represent. And to the extent that we can understand in that context with a narrative informing the why, that's beneficial. What we're looking is good information that helps us to make good decisions. Yeah.
Thank you, Plamen.
Any final questions?
Thank you.
Thank you.
Great.
Look forward to our meeting in July.
Yeah, in other words, what have you done for us lately? Yeah.
We have a preliminary budget prepared. We actually have to submit it to Brady by the end of the week here.
Yeah.
It's early, but we'll do our best to get as close as we can to what it's going to be. So, thank you.
Thank you.
Thank you so much, Plamen.
This brings us down to item 5. I need to take a short break. I don't know if anyone else does, but okay, yeah. And we don't have a whole lot of time here. I'm projecting that we may not get through our number 7 item committee reports, but we'll just see where time goes here. Thanks, Plamen.
Yeah, thank you. Yeah, I have a good team. Yeah, but it's hugely important, and sometimes you don't gather the information, then the questions come in.
We need to do
We
this.
should have been. So,
We need to have time to get up and walk around.
well, no comment on that. But, yeah. Well, I'm always open to any recommendations of how information should be presented and
Yeah.
what
And
type
I
of
really,
information should be
the
presented.
purpose was to find out about.
We kind of keep it somewhat
system that they
the
have.
same every year, but
It's an airplane, but it's.
We're all back now, whenever, are we still rolling?
I just muted it.
Oh, okay.
So we'll save this one.
Thank you. Are we unmuted now?
We're unmuted.
Okay. All right, welcome back, everyone. Just had a short recess in our Public Health Human Services Board. It's now 10:10, May 10th. We are on to item 5, includes our director's report. I think we're going to shuffle things up a little bit. We'll move item D first, and then we'll jump to A, and then EF from the consent, and then BC. To make it really clear for everyone.
Does it spell something?
Nope. I mean, not intentionally. So item D is the fiscal reporting letter.
Thank you, Commissioner Mills. I'd like to take a moment to recognize our fiscal team. After that excellent presentation from Plamen Dimitrov, we also have a recognition from the Department of Human Services for our 2024 calendar year reporting. This was sent from Temporary Commissioner Shireen Gandhi of the Minnesota Department of Human Services. As addressed to Cook County Board of Commissioners Chair Ginny Storley, the letter reads, "It is my pleasure to commend you and your staff for perfect performance in meeting the Department of Human Services financial reporting requirements for calendar year 2024. All key quarterly fiscal reports for your programs your county participates in were submitted to our Financial Operations Division on or before the report deadlines in perfect order. This effort required submission of 32 major reports covering the 4 calendar quarters of 2024. These reports are the Local Collaborative Time Study, MFIP Consolidated Fund, Client Statistics, Seeger, Income Maintenance Expense, Social Services Fund, Title 4E, Brass-Based Grant Fiscal Report. I know this accomplishment requires planning, an efficient operation, and teamwork within your county human services department. The result is timely revenue for your county and compliance with federal reporting for us at the state. Please congratulate your management and staff on this superb effort."
Plamen? Bravo.
Thank you.
And team, yeah.
Yeah, I just want to take a minute and acknowledge the work of my team. They work very diligently to receive revenue and report expenditures, and this is an important work they do, and that award goes to the entire fiscal team. And thank you for the recognition. I asked Allison to put that before the financial presentation on the agenda, but we up to an agreement, so I have to do the financial presentation first.
Yeah.
Timing is everything.
Thank you.
Yeah, well,
Thank you so
yeah,
much.
it's not much better than perfect, so well done.
So kudos Plamen, Andy, and Leah
Yeah.
of our fiscal team.
Thank you.
With that, I'll move into staff updates. Give a summary of where things are at staff-wise within our department, and then be available for any questions or comments regarding the 2 staffing-related items that were pulled from the consent agenda. I've included an updated organizational chart in the agenda materials under item 5A. Since our last meeting, we've welcomed Bob, who you met this morning, as our new Children's Mental Health Case Manager. We are recruiting for 2 vacant positions on our Children and Family Services team. We have 1 posting that closed yesterday that we're using to fill 2 vacancies. One of those positions has been vacant since January 10th, 2025, and the other was recently vacated by Marissa Eckel following her resignation in April. On the consent agenda, we have recognizing the resignation of Sarah Eisenreich as our Coordinated Crisis Response Worker. And at this point, we're doing some reevaluation within our behavioral health team. We haven't immediately posted for that Children's Mental Health Case Manager position that was vacated by Rose Downey last month. With Bob coming on board, and as we're wrapping up our temporary employment contract with Tammy, who is working with us through temporary social work, we're taking a look at caseloads and ensuring that we're well-positioned to post and recruit for that second Children's Mental Health Case Manager position. Within behavioral health, we also have additional budgeted positions that are fully funded under that State Department of Human Services Mobile Crisis Grant. Again, Sarah's resignation impacts program staffing overall, so we're taking a pause to look at needs across the program and the department. We're very excited to be welcoming Erika Ternes to the team. Erika brings a unique combination of public service experience and systems aptitude with her work with the library and schools in Cook County. Erika starts June 9th. Melissa is beginning her phased resignation with her reduction of hours effective the first week of June, and Melissa will be continuing to provide half-time onboarding and support through July to support Erika in her onboarding. At this point, I'd be happy to take any questions regarding staff updates overall and the 2 items from the consent agenda.
First, thank you, Melissa, for the overlap in timing. Really appreciate your work. Sorry to see you go, but excited for you to move on. Commissioner Gamble, you wanted to pull items E and F from the consent agenda.
Yeah. I want to be sensitive to time here, but how long in the position served? How long has served in the position? That was one question I had, and then the pay grade at which the position was at, and then we see in the consent agenda what the proposed pay grade is. So those are my 3 questions. How long Melissa has been in the position, what pay grade, what is it?
I've been here for 3 years.
Okay.
On June 21st, so I will have met the 3-year mark.
Okay, thank you.
And your question is about the pay grade of the executive admin assistant position?
That's right.
So
Where
that's-
the pay grade was, and then moving into the new hire in the position,
Yep.
how that's changed.
So the pay grade has been evaluated at a 160, I believe, as long as Melissa's been in the position for the last 3 years. So that's been consistent. It was a part of the DDA review process, reviewed, but did not result in a rescoring of that position. Are you asking about the rate for bringing Erika in and the rationale there?
No,
or-
just want to know if sometimes when you're posting the position, you're looking at new hire, you change the pay grade, and the pay grade hasn't changed. That answers my question.
Yes.
And then the other question I had relative to item F on the consent agenda was that, we had Sarah come before us 1 month previously. And so whatever we know in that regard at some point, it'd be interesting to know when Sarah was introduced and she's leaving after a month. So that was my question.
So Sarah started on March 10th, so she was with us just under 2 months in that position.
Yeah. Okay. So, yeah,
What's that?
those are my questions. Yeah.
Okay.
Thank you.
So we have 2 items that we need to act on, the hiring and then the resignation acceptance.
Mr. Chair,
Commissioner Sullivan.
I'd like to make a motion to approve the hire of Erika Ternes and the resignation of Sarah Eisenreich.
I'll support.
Okay, we have a motion from Commissioner Sullivan, support from Commissioner Gamble. Any further discussion?
No, thank you for the discussion.
Hearing or saying none, all those in favor?
Aye.
Aye.
Aye, opposed? Motion passes unanimously. Thank you. And then that'll move us on to item B,
All right.
under 5. Yeah.
So for agency report, we continue to be busy with a number of different initiatives throughout the county. Our medication lockbox initiative to promote safe storage and disposal of medications and other substances is now live. This pilot uses county opioid settlement funds and includes distribution sites at our Public Health and Human Services Department here in the courthouse, as well as Grand Portage Health Services, Grand Portage Human Services, and the Sawtooth Mountain Clinic. Our targeted population for that distribution is older adults, especially those with young children in the home, so multi-generational homes. Earlier this month, staff co-hosted an applied suicide and intervention skills or ASSIST training in Grand Portage with trainers from First Link Crisis Response Center out of Fargo-Moorhead. That work was funded by our Substance Misuse and Suicide Prevention Grant from the State Department of Health. The bike rodeo is scheduled for Thursday of this week, the 22nd, at the community center. We are still looking for volunteers for this fun event, so if any of you want to contribute to bike education in our community, you can reach out to Christina Matson and our public health team, or find that media release that went out community-wide yesterday. We were informed since our April meeting that we were not successful in our application to the state for the SUPER grant. That was the Substance Use Prevention Grant. In applying for the grant, we're not in the top tier priority for projects, but we're still eligible and felt had a competitive request. But unfortunately, we're not awarded that grant and are expecting that grants will continue to be increasingly competitive given the state and federal landscape going forward. We are continuing to monitor for new grant opportunities. The request for proposals is opening next week for the Public Health Fund 2026 grant-making cycle. Our subcommittee has been meeting to finalize our outreach materials, application materials, and evaluation tools. And we'll be putting out a media release with information to community nonprofits on how to apply for 2026 funding. As I mentioned in our financial report, we are on the agenda for the July Committee of the Whole to present on our community child care initiatives, give a media report on what is, I believe, year 3 of that pilot mid-year, and introducing some questions and strategies for our 2026 budget cycle. Continuing to monitor program cuts that are proposed at a state and federal level. I received a memo from the State Department of Children, Youth, and Families Commissioner regarding proposed changes to the SNAP program that would increase the responsibility for counties, or the state anyways, to pay a share of those benefit costs, reducing federal reimbursement of state administrative costs, expanding work requirements to older Americans, imposing work requirements on families with children, restricting state flexibility for work requirements, waivers, and exemptions, limits to the Thrifty Food Plan, which is the budget under which SNAP benefits are calculated, restricting those household utility deductions, which are used to calculate benefits, and restricting SNAP eligibility for legal non-citizens. We'll be doing some outreach in the weeks ahead just to inform community members on what these proposed impacts are and how to engage with lawmakers around protecting the SNAP program in Minnesota. I included in the agenda materials a letter that was put out by the State Department of Human Services and sent to SHAC, which is the Statewide Health Advisory Council. That summarizes the uncertainty around some of the federal dollars and the impact on public health as a state and to local public health. Given our time, I'm not going to spend a lot of time going over that memo, but included that for your information. With regards to the local impact of some of those federal termination of grants, we were notified on March 25th that a grant that we had been receiving for COVID-19 vaccine implementation was terminated. We have since received a notice from the state that that grant has been reinstated. So we're working with our county attorney and our community health board to assess the risk in accepting this grant and what this could mean for our department. Other counties within the CHB are declining to accept that grant, which could result in nearly double grant award to Cook County should we accept the grant. So we had approximately $33,000 remaining in our allocation, and there's a potential of nearly $50,000 that other counties within the CHB will not be accepting. So our intent at this point is to accept the grant and to utilize these funds for a larger project and to mirror the grant language within our vendor contract to protect any county liability around those funds. So that's something that we're actively working with within our fiscal team on a programmatic side and with our county attorney. And that's it for department updates. Happy to take questions on any of those reports. I did not put together a comprehensive legislative update, but I would encourage you to review the emails that have come out in the last couple of days from AMC for an update on where we're at in the legislative session and what that means for Health and Human Services priorities and programs.
Thank you. Any questions for Allison? All right. Well, time is running out here. We'll move on to item 6, which is items for board action. And this is the amendments to the Public Health Human Services Advisory Council bylaws. You want to give an overview of those changes?
I'd be happy to, and I invite our chair as well to comment on the intent and discussion around these changes. So in the last 2 Public Health and Human Services Advisory Council meetings, we meet every other month. So our May and March meeting, we've had extensive conversation around recruitment for that council, not just for members, but for officers. And if our bylaws are unnecessarily restrictive in terms of community members and members' eligibility to become officers within the council. So over the last 2 meetings, we've reviewed the bylaws and have proposed changes. I left changes tracking on within the document so that it's clear what is being modified. The first modification is within Section 4, Officers, subsection B, Item 2. The bylaws previously stated that the chairperson and vice chairperson shall have served at least 1 year as an advisory council member before being elected into office. Our proposed change is that advisory council members shall have served at least 1 year before being elected as chairperson. So this would remove that 1 year of service requirement for the vice chair. The council also discussed ways to provide more support to incoming members to better understand their roles and responsibilities on the advisory council, and a desire to formalize that in the bylaws. So we have added item 7 under section 5, subsection A. The agency director and council chair shall provide an orientation to new members to ensure understanding of roles and responsibilities for serving as a council member. These changes were reviewed and approved by motion at our May meeting. Anything, Frank, that you'd like to add there?
No, just that the reason for looking for these changes now is that although we have in my opinion, a very strong board, it's not a very deep board. We have to, and we are working on plans to increase the representation of the board through actively seeking new members and especially looking at geographical diversity, stage of life diversity, more gray beards than little moms and dads up there, service recipients, and non-traditional service providers. And those seeking representation of membership from those groups is included in our charter. So we're going to be actively doing that. May I encourage the board members, as you meet with various homeowners associations during the summer, that season is coming up, you might want to mention that we are looking for this. We will be contacting and reaching out for an increased membership. So that is, that's all I wanted to add to that.
Thank you. Just the date at the end says March 17th, 2020, so we just want to make sure that's changed to whatever, that May date, yeah.
So that was the last time that the bylaws were reviewed and approved by this board.
Please.
Yeah. So I would just note on page 1, under definitions, it's something I think in making the change it'd be done anyway, but there's an additional E in front of the C for council.
Mm-hmm.
Yeah.
In red. Mm-hmm.
Yeah, in red there. So it's just checking it for correctness and spelling, but other than that one, that's the only thing that I noted, and then the dates being correct. I had approved the amendment to the, as proposed for Public Health and Human Services Advisory Council to their bylaws.
We have a motion from Commissioner Gamble. Is there support?
Support.
We have a motion and support from Commissioner Sullivan. Any further discussion?
I'll recuse myself as chairman of the council.
Well, there's no benefit. There's no gain. And so I'm afraid you're obligated to vote.
And just saying and making the motion that I am on that advisory committee, so I'm familiar with the process we went through to arrive at this document.
Thank you. All right. All those in favor?
Aye.
Aye. Opposed? Motion passes unanimously. We ran out of time today, so we have our committee reports left. I'm afraid we're just going to have to pass over that and move on to adjournment. Because of that jump, I'd ask for a motion to adjourn today.
So moved.
Thank you. We have motions or support?
Support.
Thank you. Motion and support. Any further discussion? Hearing or seeing none. All those in favor?
Aye.
Aye. Opposed? Motion passes
12
unanimously.
seconds left, so that's great.
Thank you.
Thank you.
Thank you, Allison.
Yeah, we'll do that so people know where to sit out there.
Thank you, Commissioner.